Welcome and thank you for stopping by. Today we examine a severe case of dental malpractice involving a surgical attempt to place 4 implants with alarming complications and outcomes that highlight the importance of proper procedure and oversight. This panoramic X-ray reveals the targeted implant position for tooth number 30, alongside a smaller snapshot indicating a grossly misplaced implant pushed deep into the mandible, touching the alveolar nerve canal, an indication of a critical surgical error. The implantation caused excruciating nerve pain. The surgical procedure involved extensive carving of the bone and gum tissue around the implant site. This left the area with significantly reduced blood circulation. Additionally, the altered anatomy created pockets prone to trapping debris and food, increasing the risk of infection and further complications. As a result of the implant's misplacement and the compromised tissue environment, restoration options were severely limited, with specialist evaluations confirming that a prosthesis would be unfeasible due to the crown size imbalance and poor structural support. For privacy and legal protection, the individual performing will be called Dr. X. This slide shows 2 actual photographs taken in the dental office in 2019 before any surgical intervention. The left image displays the upper arch, maxilla, and the right one, the lower arch, mandible. According to the American numbering system, sites number 3, 13, 14, and 30 were healthy, with no signs of infections or risk factors. In the lower arch image, a circled area highlights the bone and gum level between teeth number 29, an implant, and tooth number 31, representing the healthy tissue condition prior to surgery. This slide shows images of bruising observed after November 16, 2019, shortly after the implant surgery. By late December, daily intake of 600 milligrams ibuprofen, as prescribed by Dr. X for pain management, resulted in severe side effects including hypertension and swelling below the right jaw. Emergency care was required, and lab tests revealed alarmingly high liver enzyme levels, consistent with hepatitis levels. Ibuprofen was immediately discontinued, and antibiotics were prescribed. However, attempting acetaminophen for pain relief proved ineffective, worsening the condition, as further detailed in the subsequent slides. The chronic irritation and misplacement of the implant at tooth number 30 caused continuous gum trauma, leading to infection and prolonged suffering. This slide illustrates the misalignment of the implants, clearly reflected by the 2 lines, red and blue, indicating the discrepancy between the actual implant position and the ideal ridgeline. When the patient pointed out that the misalignment was obvious even to the naked eye, the doctor dismissed it, stating, "This is not a problem," and suggested it would be addressed during crown placement. This response is highly unprofessional and demonstrates a lack of understanding about proper dental implant procedure and planning. This slide focuses on the post-operative X-rays from 2019, particularly emphasizing the bone and gum levels around implant positions number 29 and number 30. This slide is crucial in understanding the condition before and after the second surgery in 2020. Notably, the doctor's removal of implant number 30 involved excising a significant amount of adjacent bone and soft tissue, as shown in the later CBCT scan. This aggressive approach disregarded the necessity to preserve and plan for better structural support, leading to further complications. The premature decision to rush into placing another implant without adequate bone and gum support significantly contributed to a disastrous outcome. These pictures highlight the prolonged inflammation around implant number 30 during June 2020, a time coinciding with the global pandemic. Despite the severity of the situation lasting an entire year, no doctor I presented myself to in the United States was willing to address or manage the complications resulting from the grossly failed surgical procedures performed by the doctor in Italy. This lack of available treatment options in the US underscores the challenging position I was placed in due to the initial malpractice. Here are the details for the events in November 2020 when Dr. X removed implants number 13 and number 14 without signed patient consent or a formal treatment plan. The number 30 implant was replaced with a different brand, raising concerns about potential bias, as the doctor had known affiliations with the manufacturer. Additionally, implant number 30 was replaced with the preferred brand in a position that compromised adjacent implant number 29, which subsequently failed and was lost. While implant number 3 and its crown remained, the crown became unstable a few months after placement, requiring additional unplanned repairs. Despite these issues, the doctor insisted on proceeding without planning, asserting confidence while the patient was numbed and unable to consent. The replacement implant's positioning caused contact with the alveolar nerve canal, inflicting severe pain. Although the implant was quickly retracted, irreversible damage had already occurred. This slide describes the consequences of the November 2020 surgery, where additional gum tissue and bone were removed around implant number 29, which I had maintained for many years. This left the implant exposed, susceptible to debris and bacterial invasion, causing permanent irritation and significant pain. A gum graft surgery from the palate was necessary in February 2021 to stabilize the area, leading to added financial costs, severe discomfort, sleepless nights, and numerous work absences due to frequent doctor visits. Before the surgery, I asked Dr. X whether the implant number 29 would be compromised, to which he assured me of improvement. However, the requirement of the graft reveals this assurance was false, evidencing further harm rather than healing. This compares the two X-rays highlighting the condition of implants number 29 and number 30 before and after the second surgery in 2020. The left image shows the stable implant number 29 completely covered by gum at the initial 2019 implantation. The right image depicts significant damage resulting from the doctor's deep bone removal during the 2020 visit, which destabilized implant number 29, leading to its eventual loss a few months later. Additionally, implant number 30 was replaced and implanted in a manner that compromised the inferior alveolar nerve canal, causing excruciating, persistent pain despite high doses of sedatives. The X-ray clearly shows the top of implant number 30 aligned with the bottom of implant number 29, illustrating poor surgical foresight. This poor positioning also meant the implant was incapable of supporting the necessary crown, which was twice the size of the adjacent teeth. Here is presented the CBCT scan from March 23, 2022, showing the lateral view of implants #29 and #30. After Dr. X's 2020 surgery, he refused to discuss any treatment plan or take X-rays beforehand, displaying unprofessional nervousness. Implant #30 was placed and the inferior alveolar nerve canal perforated, causing severe persistent pain despite heavy sedation. Although the implant was retracted to reduce pain, irreparable nerve damage occurred. Importantly, multiple dental implant specialists confirmed that implant #30 needed removal and that a bone graft procedure was essential to rebuild and stabilize the site for any future implant attempts. Because U.S. doctors refused to address this failed procedure, likely due to legal concerns, I had to travel to Costa Rica for implant removal, incurring significant extra costs and burdens. Here is presented my detailed letter to Dr. X dated January 14, 2021, summarizing the extensive consequences of his surgical malpractice. Despite paying in full and traveling internationally twice, even during a pandemic, I endured implant misplacement of number 30 and number 13, visible even to the naked eye, and confirmed via CBCT scans. Dr. X displayed a troubling lack of transparency, refusing to discuss treatment plans or properly utilize imaging data. The negligent removal and replacement of implants led to severe complications, including exposed and irritated gum tissue around implant number 29, requiring costly grafting procedures and serious gastrointestinal damage. Dr. X ignored patient consent, removed implants without permission, and rushed treatments without regard to long-term prognosis or patient well-being. This letter documents my experience and demands explanations for the disastrous outcome caused by his inadequate care. I presented my detailed letter to Dr. X dated January 14, 2021, that summarizes the catastrophic consequences of his surgical malpractice, including gross misplacement of implants, #13, #30, and loss of implant 29. Despite paying in full and traveling internationally twice amid a pandemic, the complications, nerve damage, and disregard for proper treatment planning caused severe harm. Dr. X refused to respond to my emails following the second round of surgeries and further refused to engage in mandatory legal mediation sessions. Since then, I have actively sought expert opinions from a wide range of professionals, including dental specialists, forensic doctors, university professors, and legal experts, to fully assess the damage and chart a path forward. I am fully open to sharing my case for legal scrutiny, professional review, educational purposes, and recommendations to help myself and others navigating similar situations. This transparency highlights my commitment to accountability, healing, and supporting others experiencing dental malpractice.